Hello, my name is Melissa Campos, and this is
Martia Baza.
and our topic is on forensic nursing. In this video, you will be informed of the preparation required, job description, salary range, and other important information concerning forensic nursing. First off, the preparation to become a forensic nurse takes a couple of steps. If you are interested in forensic nursing early on, you could start taking classes in high school, such as anatomy, biology, and scientific concepts. After high school, you will need to receive your associate's or bachelor's of science in nursing in order to become a registered nurse. After becoming a registered nurse, you will need to get your license, which could be obtained by passing the National Council Licensure Examination, also known as the NCLEX. If you want to expand on your education, you could get your master's degree in forensic nursing. Master's degree in forensic nursing will allow you to work in sexual assault nursing and will also allow you to specialize on the intersection of the legal system and medical system. You will be trained in physical head-to-toe assessment of a patient, which includes checking vital signs and for any signs of foul play such as bruises, burns, or cuts. Forensic terminology to prepare you in communicating with other legal officers on the crime scene. DNA technology in order to use in the lab for DNA testing. Forensic and differential evaluation of findings. During evaluation, you must be familiar with the omniochrome, which will help find fingerprints, and a coloscope, which is a device used to obtain tissue samples. Collection and preservation of forensic evidence, which would include handling evidence such as hair, fibers, and swabs of fluid for DNA testing. Documentation and photography, and preparation for court testimony. National certificates. There is no actual certification of general forensic nursing. The only type of certificate you could obtain is the SANE certification, which stands for Sexual Assault Nurse Examiner. How to obtain it. Depending on what age group you would like to specialize in, you can take either the pediatric or adolescent sexual assault nurse examiner exam or the adult sexual assault nurse examiner exam. But before taking the exam, registered nurses must take a sexual assault examiner class, which is comprised of 40 hours of classroom training followed by an average of 40 hours of clinical training. Here's a video about the typical job description of a sexual assault nurse examiner.
A sexual assault nurse examiner is a registered nurse that's been specially educated to provide comprehensive care to a patient who has experienced a sexual assault and doing it in a very compassionate and sensitive manner. So to break that down, we start by asking the patient what has happened, and they have to explain to us what has brought them to the emergency department for us to care for them. We move to do a head-to-toe assessment, a detailed genital examination, and throughout that process, we're also preserving any evidence and doing that collection process. And then that is put into a sexual assault evidence collection kit, and those specimens are released to that of the law enforcement agency. And we then finish with the patient addressing issues of their health, welfare, their safety, the discharge plan for them, any diseases that they have been exposed to, and providing that medication.
What does a forensics nurse do? If you want to go beyond the typical duties of a nurse and long to approach your work from a law enforcement angle, a forensic nursing job might be for you. Forensic nursing is a cross between a healthcare profession and a judicial system profession. It's a profession where the legal system and medical system intersect. Forensic nurses perform duties that are much more specialized than nurses typically perform. They have a variety of roles, including evaluating and caring for victims of assault, domestic abuse, child and elder abuse, neglect, and sexual crimes. As they treat the victim, forensic nurses collect and secure evidence. The nurses must ensure they follow the chain of custody so the evidence reaches the authorities after being documented. Most of the time, forensic nurses spend their time in emergency rooms to help interpret any sign of foul play. Forensic nurses may also be asked to testify in court about the medical information and the evidence that they have collected. Typically, the forensic nurse usually treats the patient, takes photographs of the crime scene, the victim, or the perpetrator, collects and preserves evidence, and testifies in court. The key skills of a forensic nurse include having compassion for your patient. You will also need critical thinking skills as well as a moral and ethical reasoning so that the choice you make are unbiased and not personal. Emotional stability is also important for a forensic nurse because traumatic situations can occur and you must stay calm about it. Communication skills so that you can easily follow directions and easily communicate with patients and their family. Having patience is also important when you are a forensic nurse, and paying attention to detail is very important because one mistake can cost you a life, or it can also cost you an entire legal case. Organizational skills because there is a lot of documentation included in this profession. Salary range. The salary range of a forensic nurse varies from place to place. In California, the salary average is $61,000 per year. The average forensic nursing salaries for job postings in California are 7% higher than average nationwide. The salary ranges from $55,000 per year to over $200,000 per year, depending on how experienced you are as a forensics nurse. A few advantages of forensic nursing include acquiring a unique skill set as they are specially trained in all areas of forensics, such as collection of evidence, knowledge in criminal procedures, and legal testimonies. This profession also allows for a variety of specialties, including legal nurse consulting, nurse coroner, death investigation, sexual assault nursing, community education, correctional nursing, and gerontology specialization. It also gives you the opportunity to work in a field alongside criminal investigators, collecting samples and evidence at a criminal site. Forensic nurses are typically offered a professional package that includes great benefits and high salaries.
The disadvantage of being a forensic nurse would include being prone to high levels of stress that may be acquired from witnessing and observing the aftermath of gruesome scenes and cases. There is an immediate requirement of time as most evidence that need to be collected from a crime scene, such as DNA samples, are time sensitive. The profession also leaves no room for empathy and must be somewhat detached from emotions due to severity of cases. Emotions may not be addressed and objectivity needs to be kept to yourself. They have to appear on legal meetings such as court hearings, which makes it more time consuming.
Here is our works cited page where we got all our information from.
Thank you.
Hope you enjoyed our video.